So we hit 7, and then we'll start chatting. All righty, it's 7 o'clock, so I'm going to get going. I know people are going to be trickling in as we go through or get started, but to have some respect of everybody's time, I'm just going to hit it. So my name's Hillary Wright. I am a registered dietitian, and I am the director of nutrition for the Domar Center for Mind Body Health at Boston IVF. And so I wanted to welcome you all to PCOS, diabetes, fertility, and nutrition. So it's kind of a broad category, but all of these things have a way of kind of weaving their way into the fertility journey one way or the other, as well as often for lifelong health. So I think anything we talk about today actually is actually appropriate for good, healthy nutrition, no matter what your goal is. Because largely what we'll be working around is the whole concept of plant-based eating, with some specifics about the fertility stuff. So just a little bit of background on me. I've been at the Domar Center since 2006. And prior to that, I was at Harvard Vanguard Medical Associates in Kenmore Square in Boston, which is where I actually started to get involved caring for women with PCOS. So that's where my fertility thing started, was with the PCOS piece. And that actually came about because I had been working there for a while and was experiencing secondary infertility, and went down the hall and met with a reproductive endocrinologist who worked in the same practice as me. And so that's how I actually really got involved in this area, because I actually have been there and I know what it's like. I was fortunate to have some minor hormonal tweaking as it goes, and had my second child, and then I had a surprise third one because I made some assumptions about my fertility. So through that journey, I've had all the tests, I've had the biopsies and the dye studies and the injections and all of those kinds of things. So it gives me kind of a unique perspective and empathy for women who are dealing with this, because I know what it feels like. So in terms of my background, I have an undergrad degree from the University of Massachusetts in Amherst in human nutrition, and a master's in health education from Boston University. I did my internship at Mount Auburn Hospital in Cambridge, Massachusetts. And I currently also, in addition to the Domar Center, work part-time at the Dana Farber Cancer Institute in Boston. So it's interesting because I have these very varied areas of practice, but there's a tremendous amount of overlap in terms of the recommendations that are made, whether somebody is trying to enhance their cancer survivorship, or somebody's trying to optimize their fertility. So we kind of decided that the best thing to do in terms of, actually, I forgot. I also write books. So some of you may be familiar with that. The first book that I wrote came out in 2010, was the first edition of this book, which is called the PCOS Diet Plan. So the first one was Green Around the Edge. This is a revised edition that came out in 2007. 2017. The interesting thing about this is when the first edition of this book came out, there actually weren't a lot of other books out there. So Angela Grassi, her PCOS Nutrition Center, and she has a great website. She was out there, so I had to go find the people that were also practicing in this space. Martha McKittrick in New York City, who goes by PCOS Girl, I believe, online, GURL. Those of us who were in this practice area had to kind of find each other and become friends and partner, because there's still, to this day, it's 20 years later. So I saw my first woman with PCOS in January of 2000. So there were still not enough nutritionists working in the space. But what I did notice was very different between the first edition of this book and the second one is a lot more books came out. Some of them good, some of them not so good. So the first thing I want to say is I'm well aware and empathize with the overwhelming amount of research online about PCOS, not research online, stuff online about PCOS, much of which is not evidence-based and makes healthy living seem way too hard. So the goal of the PCOS diet plan is it's basically broken down into 3 parts. The first third is like, this is what PCOS is, this is what we know, this is what we still need to learn. These are what we think are the health ramifications of, or the potential health ramifications of a PCOS diagnosis, and how it can affect fertility as well as diabetes risk, heart disease, things like that. How it can make weight control more difficult, how there is more than one variant of PCOS, so that we, even in the healthcare industry, there are still people that don't recognize women with PCOS unless they have the typical presentation of, excess weight, facial hair, acne, unless you're the total package, oftentimes people won't even listen. And we do know that there is a lean variant of PCOS, and sometimes I think those are the women who are the most ignored because people don't believe you can have PCOS. So I think it's good that there's more information out there, but I also think it's bad because a lot of it I don't think is very evidence-based or helpful, or really creates a lot of confusion. Very quickly, I've written a couple of other books. One is called the Prediabetes Diet Plan. This was a follow-up to the first edition of the PCOS. They're both involve insulin resistance. So I figured there is an enormous population of people at risk of diabetes. And last year, right about a year ago now, I had a book come out called the Menopause Diet Plan that I wrote with my best friend from college, my dear friend and colleague, Elizabeth Ward, who is also the author of Expect the Best, Your Guide to Healthy Eating Before, During, and After Pregnancy. So the reason I really recommend this book to my clients is because, again, you can read a lot of stuff online if you're interested in prenatal nutrition that makes it seem really complex and confusing, and Liz really gets to kind of the bare bones basics on that. So without further delay, that's just a background of me. Oh, I should say, the Domar Center for Mind Body Health at Boston IVF is a multidisciplinary practice. So I'm the director of nutrition. We have several incredible therapists there. We have several incredible acupuncturists, and everyone is there to try to help women with fertility challenges in general, deal with or practice some self-care, to help alleviate some of the burden and the stress of the fertility process. So the birth of the Domar Center, my understanding is, came from research that was telling reproductive endocrinologists that women and couples who actually had really good likelihood of success with fertility treatment were actually dropping out of the whole process because the stress was just to the moon. So we try to help women and men get their lives back amongst the chaos of the stress of fertility treatment. So the questions are going into the chat. So I'm just going to start hitting on the questions. And I know some people may end up in a different function to ask questions, a Q&A, but Emily, who is the trusty fertility person, the trusty technology person behind the scenes here, is going to be forwarding those questions to me if they occur. So I'm just going to start going through them now. The first one being, I want to treat my PCOS more naturally, but I'm on birth control to control severe endometriosis. Advice. So what I would say is, if somebody has PCOS and endometriosis, both of those can affect their fertility. So I think treating them to whatever degree they are best managed, and that could include birth control, is important. So birth control pills don't treat PCOS as much as help to regulate your period so that you get a menstrual period on a regular basis. So some people may have heard that, for example, women with PCOS who don't ovulate and don't get regular periods may have an increased risk of endometrial cancer at some point. And that's largely my understanding because they're not shedding the lining of the uterus. So if you're on birth control pills, it helps to manage the PCOS risks there. It helps to regulate hormones. And it can be somewhat necessary with endometriosis. So I feel about birth control pills the way I feel about any kind of medication, any health factor that has the ability to be managed with diet and lifestyle strategies. We want to try to manage it naturally that way as much as possible, and then maybe use medications as needed to kind of get over the goalpost. So for example, both PCOS and endometriosis may respond positively to an anti-inflammatory diet. An anti-inflammatory diet, so if we start, probably the easiest way to describe an anti-inflammatory diet is plant-based eating. So plant-based eating doesn't mean that you have to be a vegetarian or a vegan, not at all. Plant-based eating, and I talk about this in my books, and actually anybody who's seen the visuals that they now use to teach children about good nutrition principles, it's called Choose My Plate. That is a visual of plant-based eating, which is basically a Mediterranean diet on a plate. So any health organization that is presenting a food visual for what healthy eating looks like uses some version of what we call a balanced plate. So the Harvard Healthy Eating Plate looks just like that Choose My Plate. And so again, it's a plate with a line down the middle, and one half of the plate is cut in half again. About a quarter of it some sort of protein, about a quarter of it some sort of a healthy carbohydrates. You know, carbs are not the devil. There's a big quality and quantity issue there. And then half the plate being vegetables, trying to vary things up, as well as fruits. So it's many of the compounds. We can talk about this more if people have specific questions, but we think that probably a lot of the health benefits from plant-based eating actually come from the fact that plants contain compounds that act as their immune system, which we lump together and we call phytonutrients. Phyto just means plant in Greek. Phytonutrients actually represent the immune system of the plant, and that their goal is to neutralize inflammation, neutralize oxidation, and help our body to detoxify itself. So that's actually what our immune system does. And plants have an immune system as well. And we now understand when we eat those plants, we get the benefits of the variety of the healthy anti-inflammatory compounds that they contain. So these same compounds that act as these natural anti-inflammatories also actually give the plant their color and their smell and their taste. So when you see these very simple nutrition messages that say, eat according to the rainbow, or eat a variety of colorful fruits and vegetables, it's a way to simplify a message around eating plant foods allows you to benefit from their immunochemistry. And it makes more sense to say vary up the color than to eat more isocyanates and polyphenols, which are the names of some of these compounds. So when the research that's available on endometriosis to this point is fairly limited, the stuff that I've read suggests plant-based anti-inflammatory eating, limiting red meat, is beneficial for endometriosis. Well, I think that's also beneficial for PCOS. So I actually think there's just overlap between those two. So again, do the diet and lifestyle stuff, use the medications as you need, because everybody knows that endometriosis can be very painful and life-affecting. Okay, PCOS that is not insulin resistant, ways to treat, foods to avoid, or is it all the same? I would say it's actually all the same. So what I will say about insulin resistance is the most widely used way and most reliable way to assess for insulin resistance is to monitor people's blood glucose levels. Now, the thing about the blood glucose testing, so that's a fasting glucose, it's a hemoglobin A1C, sometimes it's drinking the goop for a glucose tolerance test. That testing tells you whether you've been insulin resistant long enough that it's now starting to affect your blood glucose levels. So insulin resistance, which is what it's testing for, is something that occurs in a spectrum. So insulin resistance in its most advanced stage is type 2 diabetes, but everybody with type 2 diabetes has a period of time prior to that where their blood sugars are starting to bump up, but they're not as high enough to call diabetes. We call that pre-diabetes. But everybody with pre-diabetes had a period of time, generally years prior to that, where they had some insulin resistance, but their pancreas, which is the organ that makes insulin, was youthful and energetic enough to just make more insulin. So they can do fasting insulin levels to try to tease that out. though I will say everything I've read suggests it's not a standardized test. So that makes it hard to kind of interpret necessarily what is a normal insulin level. So the pre-diabetes is often diagnosed based on risk factors like PCOS, having some excess weight on board, family history of diabetes, though you don't have to have a family history of diabetes to develop diabetes, metabolic syndrome. So those kinds of things will only start to, the insulin resistance there will only start to actually show up on your blood glucose testing once you've been insulin resistant for long enough for it to start to kind of tucker out your pancreas. So the reason I'm bothering to go through all of that is that it's hard to exactly say if somebody is 100% not insulin resistant. And we know that in lean PCOS, insulin resistance occurs there as well as it does in what many people perceive as the more classic presentation of women that are overweight. So it tends to be less severe in women with the lean variant, but it may still be there. So we just need to, well, let me back up and say the same things that you would do to optimize your fertility are also the same things that you would do to manage any presumed underlying insulin resistance. So that's why it's all the same. In terms of the foods to avoid, I'm not a big fan of lists of foods to avoid because I know enough about nutrition science to know that individual foods don't affect your health. Don't turn your health on and off like a switch. The only instance where that might be the case is if somebody had a bad allergy and it would either like close off their airway or make their lips blow up. But aside from that, the role of nutrition and health is very synergistic, meaning the foods that we eat or don't eat, whether or not we're getting an exercise, physical activity, whether or not we're getting enough sleep, socializing with other human beings, managing our stress, all of those things create an influence collectively to affect the environment of your body. So it's the environment of women's bodies and men's bodies. That's where eggs and sperm live. And before, in case I forget to say this, I really want to share this because I think it's important. And again, I understand this because I went through the fertility process. When a couple goes through a fertility workup, the man generally provides a semen analysis, a semen sample for a semen analysis. And what they do is they're monitoring for morphology, motility, and count. So they're looking at how many sperm are there, are they moving around, and do they look the way we want them to look? The woman then has hormonal tests and kind of the preliminary stuff. But that semen analysis does not tell us everything we'd like to know about the genetics in a man's sperm. And it takes a genetically healthy sperm and a genetically healthy egg to meet up and decide they're a good match. So I did a presentation on male fertility and diet and lifestyle for the Academy of Nutrition and Dietetics a couple of years ago. And I asked Michael Alper, the head of Boston IVF, I asked the head of the andrology lab and one of the reproductive endocrinologists, and they all said the preliminary testing they do on men does not tease out how their diet and lifestyle might be affecting the genetics in their sperm. And I think it's important to understand that because otherwise it feels like women then have to shoulder the rest of the burden. And so anything that a woman does to improve her fertility is also going to be good for her husband. So in other words, the guy is not off the hook just because he had a normal semen analysis. He needs to be mindful of his diet and lifestyle as well. Hi, Nadine. I'm good. Does metformin help with PCOS? Yes, it does. So metformin is commonly used during the fertility treatment process in particular to help optimize cycles and contribute to success. What I will tell you about metformin in general, so metformin does a few different things. And I don't even think I know everything that metformin does. Metformin is kind of a wonder drug in some ways. It's been around for like 50 years or 50 or 60 years. Of the things that it does that can affect fertility and insulin resistance, metformin is an insulin sensitizer. So it helps cells be more receptive to the action of insulin. The more receptive our cells are to the action of insulin, the less the pancreas feels compelled to keep chugging it out. Metformin also prevents us from absorbing some of the carbohydrates we eat. So that's why, particularly when you start it, you want to start it slow and gradually increase it, because it can give your stomach, the gurgles, bloating, sometimes pain, sometimes diarrhea. And my sense is a lot of that is from undigested carbohydrate moving its way on down. So it's helpful to let your gut get used to that over time. It's also important to keep in mind that if you're taking metformin and you eat a lot of carbohydrates, you may potentially be more symptomatic because of the volume of carbohydrates that may be not getting digested. Metformin also interferes with what's called gluconeogenesis, which is the release of glucose from your liver. Because after all, glucose from the liver is a source of glucose in the blood. But it's also why, if you read the fine print, it's really important not to binge drink on metformin, because that also blocks gluconeogenesis, and it can create potentially a very dangerous complication. I think it's called lactic acidosis. So if insulin resistance is producing excess or kind of creating an environment where your body requires excess amounts of insulin to regulate your blood sugar. So insulin resistance is, here's a cell on it, it has a receptor, like a keyhole for insulin. Insulin is secreted into our blood in response to the presence of glucose in the blood. So I encourage women who have insulin resistance to eat, quality carbohydrates and spread them out in smaller quantities over the day. So blood sugars are rolling like this, and then insulin levels roll accordingly. And so when glucose first shows up in your blood after digestion, it passes through your pancreas, and your pancreas secretes out what it thinks should be enough insulin to be like that key and unlock all those cells. In insulin resistance, that receptor is kind of numb to the action of insulin to varying degrees. So it could be pre-diabetes numb, pre-diabetes numb, diabetes. So it's higher levels of severity. But if somebody is insulin resistant, it means these receptors are resistant to the action of insulin. So the pancreas secretes out what it thinks should be enough insulin. The insulin butts up against the resistance. The pancreas figures that out, secretes more insulin to overwhelm the resistance. And the net result is perhaps higher than perfect levels of insulin floating around that can then start throwing a wrench into reproductive hormone communication, causing either the irregular or absent periods, generally seen in women with PCOS, but also creating inflammation that can affect egg quality and sperm quality in men. So metformin is, again, it's a tool in the toolkit, but I can tell you that when it comes to managing insulin resistance, diet and lifestyle is much more effective in the long term. And that's based on the Diabetes Prevention Program, the DPP, which is a very large, well-done study that took people with prediabetes, and they gave them either what I call brochured them, gave them a brochure, you have prediabetes. We know that does nothing for anybody. The second, so these are all people with prediabetes that were trying to figure out, can we reduce their risk of developing diabetes? 3 years from now, we're going to go back and check. So that was the brochured group. There was a group put on metformin, and then there was a group that underwent an intensive diet and lifestyle program. 3 years later, the brochured people were as diabetic as they thought they would be without any intervention. The metformin people were 31% less likely, and the metformin people were 31% less likely, and the diet and lifestyle people were 58% less likely. So that tells me that diet and lifestyle is the primary treatment. And then if somebody needs metformin to get them over the goalpost, then that's what they should do. There's also a supplement called Inositol that is used to act as an insulin sensitizer. So it works on a different pathway than metformin does, but has been studied up against, like neck and neck against metformin, inositol versus metformin. And some of the studies are finding that the inositol behaves very favorably when put up against metformin. So I'm not telling people to throw out your metformin and just take the inositol. It's something to talk to your clinician about. The product I generally don't endorse specific products, but it's really important with inositol to take a supplemental form in the form that it occurs naturally in our body, which is a ratio of 40-1 myoinositol to d-chiroinositol. So the product that I usually recommend is called Ovasitol by a company called Fertility. I like their products for a number of reasons. The first is each little packet, they leave these little pink packets or a container with a scoop, is 2,000 milligrams of myoinositol and 50 milligrams of d-chiroinositol. So that's that 40-1 ratio. You take it twice a day, and that replicates some of the research studies that used inositol as an insulin sensitizer. So there could be other products out there. I think somebody else told me about another product they took. I couldn't remember the name. But Theralogic's also third party verifies their products to an independent lab called NSF. So I know, and they're actually price competitive. A lot of supplements are not cheap, inositol included. So my feeling is if you're going to buy it, you might as well get one that that at least we know what they say is in there is actually in there, because you folks may know that dietary supplements are not regulated by law. There's actually laws preventing dietary supplements from being regulated. Yes, I do see men. Okay. Hannah, do you think you need to do IVF PCOS if you had a chemical pregnancy and a blighted ovum? That's actually a reproductive endocrinology question. That's not something that I feel qualified to answer. I just wanted to say I read the PCOS diet book and it was great. Thank you, Kristen. Sometimes I think the book does not make enough false promises to get some people's attention. So I really appreciate when people understand what I'm trying to do with that book is help people understand the physiology of how your body works when you have PCOS, when diet and lifestyle can get in the way, and then how diet and lifestyle might help. But it's really important to me that women understand that, not just by reading a set of rules of do's and don'ts, but to really understand how their body works. Is there a way to increase my egg quality? So if I just take that as like a general question, so egg quality can be related to a lot of things. And so again, a lot of that detail I will leave to the reproductive endocrinologists. In terms of diet and lifestyle strategies, the evidence suggests plant-based eating, again, an anti-inflammatory kind of diet. So that's this balanced plate visual. I have these in my books. They're all over the place. If you go to the Harvard School of Public Health and Nutrition and look for the Harvard Healthy Eating Plate, that's also a really good example of an anti-inflammatory diet. Vitamin D may be beneficial for egg quality. So there's some research looking at vitamin D levels and IVF cycles and egg quality and embryo quality. And so people do not want to be vitamin D deficient. I live in right outside of Boston, and up here in the north, we don't get enough sun exposure year round. So really we synthesize minimal amounts of vitamin D from October to April. So for people that aren't currently taking vitamin D, this is a good time to start taking a vitamin D supplement, either as part of a multivitamin with minerals, which is never going to hurt. A good quality multivitamin with minerals with at least 25 micrograms of vitamin D. Going into the winter, you may want to take another 25 micrograms. So that's 50 micrograms. Micrograms are what is now increasingly on vitamin D labels. International units are being phased out. So when you now see 1,000 IUs on a bottle of vitamin D, it'll also say 25 micrograms, and increasingly the IUs are going to disappear and the micrograms are going to be there. So 50 micrograms or 2,000 IUs of vitamin D through the winter. Vitamin D is also an anti-inflammatory. And then coenzyme Q10 has a decent amount of research. Most of it done, the stuff I've read on younger women with premature ovarian failure, where they took CoQ10 supplementation, spread it out over the day. So the biggest study that I've read used 600 milligrams of CoQ10, 200, 200, 200. My understanding is that you really want to have like a at least a 2-month kind of runway of time to be able to take CoQ10 prior to a retrieval. to hopefully have it be beneficial. But if you've got, at least that 8, to 12 weeks, some supplements come in like 300 milligram doses. You could take 300 and 300 if you felt like 200 was too laborious. Again, Theralogics makes one called NeoQ, which is better absorbed. So they're 125 milligram capsules that are absorbed at the rate of about 300 to 350. You would take one in the morning, one at night. And there's some decent evidence around egg quality. What are the best supplements to take for PCOS? So again, I just have to answer this generally because, sometimes there are unique circumstances. But again, a good multivitamin, multi-mineral supplement. Inositol is a good one. It tastes like nothing. I mean, it's a powder, slightly sweet taste, very easy to tolerate. Those are the primary ones that I use with my population because the vast majority of my women are going through fertility treatment. So there are other supplements that people may use. NAC is one of them, N-acetylcysteine. There's some research looking at 600 milligrams of NAC 3 times a day, looking at egg quality and menstrual cycle regularity. Most of my people are cycling. And so given the lack, I don't really worry about it, but given the lack of true safety data, I tend to not use a lot of NAC. But if somebody was not actively trying to conceive, there's also DHEA, which is generally not in PCOS women. But while we're on the topic of supplementation, DHEA can affect your testosterone levels. And for that reason, I defer to the reproductive endocrinologist as to whether they think a woman is a good candidate for DHEA. My feeling is if you read the box, it'll tell you the side effects are acne and oily skin potentially. If something is that much of a hormone stimulator, then I think the reproductive endocrinologists need to be in the loop in case it may have any role to interface with the treatment. Can I talk about the importance of hirsutism levels of PCOS? So hirsutism is excess facial hair growth where you don't want it. So women with PCOS often have these hair issues that are related to the increased levels of testosterone. So hence the facial hair and the potential for thinning of hair on the crown of the head in a male pattern way. So hirsutism is, and again, it's undoubtedly much more complex than what I can offer as a dietitian. But if somebody has insulin resistance and they have higher circulating levels of insulin in their body, so if your body is secreting insulin to regulate your blood sugar, extra insulin, well, that extra insulin is going everywhere and it's going to touch everything. And so I already mentioned how that extra insulin can throw a wrench into your reproductive, what's called your hypothalamic pituitary ovarian axis. It's this communication between your hypothalamus and your pituitary in your head and your ovaries, this kind of cyclical thing that ideally would cycle uninterrupted month to month to month to provide an opportunity for conception every month. Those hormones can be messed with by other hormones, including insulin can interfere with that. But also there are other tissues around the body that are really, really insulin sensitive. And the cells that line the follicles where eggs develop, they're called theca cells. Theca cells are really sensitive to the effects of insulin. And when touched by too much insulin, can increase their production of androgens like testosterone and dealing with the hirsutism. Okay, loving all this information. I'm going to try for winning no parents and listen, but not. Yeah, again, anything about drugs like Provera and medications, again, from a PCOS, from a nutrition standpoint, all I can really speak to is dealing with the, trying to manage the underlying insulin resistance through what I call a moderate carbohydrate diet. That's what that balanced plate is. I am not a fan of keto. I don't think it's sustainable. I've been doing this for 34 years. I don't know why this temporary diet for most people is going to be a temporary diet that excludes a lot of very healthy foods that have actually correlations with better IVF outcomes. So for example, there's research on, what are people eating in the year before IVF? So it's kind of associations. It doesn't necessarily tell us cause and effect, but eating fruit and eating whole grains are two examples of things that often get tossed on an overly restrictive low carb diet. That means your fiber intake is going down. Okay, that's not good for your microbiome, for your gut. You're not getting those phytonutrients. So again, I'm into the idea of a moderate carbohydrate diet spread out over the day. I'm into the idea of food distribution. Anybody who's met with me knows that I'm always drilling down with people, and not just what are you eating, but how are you eating? What time of day are you eating? I do believe there's value in what's called extended time fasting for people with insulin resistance, meaning no, not skip breakfast like the CrossFit people say, don't eat breakfast and then eat from noon to 8. Insulin sensitivity in people with insulin resistance is likely better in the morning and worse at night. So if you're skipping breakfast, you're missing one of the most opportune times of the day to be eating healthy carbs. So again, probably the best I can say is to check out my book if you think it would be helpful. I have PCOS, why my LH and test positive, but I didn't get my product. Yeah, again, I can't speak to the specifics of hormone tests and IVF and fertility treatment. Is it okay to be on birth control pills for PCOS if I have a plan for IVF? Yep, again, I would turf that to the reproductive endocrinologists. Obviously, you have to go off them at some point. My sense is you don't have to be off of them for that long to cycle, but again, yes, you can take inositol with metformin. It's not likely that people are going to get sensations of low blood sugar on these two things. In theory, it could happen. It's not dangerous. It just might feel a little uncomfortable, but yes, it is possible to take both at the same time. Does PCOS make it harder to get pregnant or stay pregnant, or both? Yeah, PCOS is considered the primary influence of fertility challenges related to not ovulating. So it can be harder to get pregnant. So again, the emphasis is on managing the insulin resistance to try to get the insulin out of the neighborhood of that hypothalamic reproductive, hypothalamic pituitary ovarian axis, get the insulin out of the way so your hormones can communicate. My general understanding is women with PCOS may have higher rates of miscarriage, but again, I would turf that to the docs. Okay, do you meet with patients with PCOS and are looking to go through treatments? I'm sorry if you went over this already. I was late to the webinar. Yeah, I do meet with PCOS. So I need to tell people too, I'm only licensed in the state of Massachusetts, which means I'm not supposed to do telemedicine outside of Massachusetts and New Hampshire, where I also can do it. What to do about hormonal acne with PCOS while trying to conceive? Is it all nutrition? Yeah, well, what I know is that if you're trying to conceive, some of the things they may otherwise give you for the acne, you may not be able to take. So if the acne is related to insulin resistance and testosterone, then again, all roads kind of lead back to managing the insulin resistance, which, by the way, women with PCOS are considered at higher risk for gestational diabetes because pregnancy makes women insulin resistant. So if you're already insulin resistant and then you get pregnant, as the placenta grows, the placenta makes hormones to make the mom insulin resistant to preserve glucose in circulation to fuel the baby's growth. So if there's already some insulin resistance there, it's not hard to understand how you may be at high risk for gestational diabetes. But what I would say is anything that you learn, again, certainly from the approach that I would take, which is not over restrictive and kind of focuses on that kind of balanced eating approach, spreading your carbohydrates out to manage your post-meal insulin bumps, so forth and so on, is a perfectly healthy and appropriate thing to continue to do when you're pregnant. What's the best way to reset hormone balance? That's such a general question. And I have to say, and this comes up a lot because I also am involved in the menopause world. They say, write about what you know. And there's a lot of promises being made online to balance your hormones. And it's really irritating when it comes to menopause to suggest that there's something that you can do to restore your estrogen when you can't. So you can certainly do things to manage the likelihood of having side effects of symptoms of menopause, but you can't bring your estrogen back. And so hormone balance is insulin sensitivity. That is hormone balance. Insulin resistance can eke out into the other hormonal imbalances that are present in PCOS. Even without PCOS, having excess weight on board can cause your hormones to cause insulin resistance and maybe trigger some hormonal imbalances related to reproductive hormones. So that's in a nutshell. We used to think that body fat was just a oil tank of calorie reserves, and now we understand that body fat actually is an endocrine organ, produces its own hormones. So if excess body fat is interfering with someone's reproductive cycles, their egg quality, how often they ovulate and menstruate, the good news is that studies tell us losing as little as 5 to 10% of your weight may be enough to make you more responsive to the treatments and have better outcomes. And that would be regardless of what your body mass was once you lost the 5 to 10%. So I get irritated when people talk about BMIs below 25 and all of that. BMI is an imperfect metric, and it doesn't say anything. It doesn't tell us anything about whether someone's active or not, what the quality of their diet is. And so when we hang our hat too much on just the BMI and the weight issue, it can deprive people of appreciating, regardless of your weight, the advantages of plant-based eating, regular physical activity, sensible supplementation. Yes, do I recommend Myoinositol for managing insulin resistance? Yes, I did already talk about that earlier in our session. I don't see any other questions right now, so I can just back up to it for a second. Myoinositol, what I recommend is a supplement that's a combination of myoinositol and D-chiroinositol and a ratio of 40:1. So I mentioned earlier that the product that I generally recommend the most is called Ovasitol by Theralogics, because it's a very easy to take powder that is 40:1. The ratio is 40:1, 2,000 milligrams of myo, 50 milligrams of D-chiro. Okay. So I later, can you do a telehealth visit with me? Yes. So this is the thing about New Hampshire. New Hampshire, from a licensing standpoint, is what we call a green state, which means you don't have to be licensed in New Hampshire to practice nutrition counseling there, but insurance companies could decide they won't reimburse for somebody who's not licensed in the state. It has never been an issue for me to this point. I believe actually the same applies for Connecticut and Vermont, but I know that Maine and Rhode Island are red states, which means you have to be licensed in their states in order to do nutrition counseling with people from those states. Now, if somebody from one of those states is physically in Massachusetts, then I can do it, which, the Domar Center still continues to be all remote, and I'm not sure when that might end. If it will end, people seem to really like the telemedicine a lot. I can also tell you I'm only there part-time and my access is pretty tight. So I was forewarned to expect a wait. But, for example, if I was contacted by somebody from a faraway state, they would probably have to do the legwork to see if I was able to do telemedicine with them, because my understanding is I can't unless I'm licensed in that state. Okay, I can't take birth control. What can I do to get my periods natural? Can Metformin be dangerous when pregnant? There are actually a lot of physicians that keep women, particularly women with PCOS, on Metformin through the first trimester. And I'm assuming they're doing that to maybe increase likelihood of the pregnancy continuing. Again, that would be a good question for a reproductive endocrinologist. So what can I do to get my period natural? So again, if you have PCOS, again, the best I can do is suggest you read the PCOS Diet Plan. The Menopause Diet Plan book just addresses insulin resistance in general. So if we assume anybody with a BMI, a body mass index, over 30, likely has some degree of insulin resistance. So either the PCOS Diet Plan book or the Prediabetes Diet Plan book will teach you everything you need to know about managing insulin levels, which is good for fertility and egg quality, regardless of the cause. So I think, again, a reproductive endocrinologist is probably better suited to assess all the ins and outs of the pregnancy safety, though I do see it continued through the first trimester of pregnancy, and I've seen it continued through whole pregnancies on occasion. One thing I want to say about metformin, if you're on metformin for a really long period of time, like years, some people are out on years, metformin does interfere with vitamin B12 absorption. And so you want to make sure you're taking a B12 supplement or a multivitamin with B12. How about collagen? Any opinion on that? Collagen is protein powder. It's expensive. If people don't mind paying for it, I know people that love collagen powder. Most of what I hear are older people like me or older than me, who swear that collagen powder helps them with, arthritis and so forth. I have no concerns about it. I just think it's very expensive protein powder. I tend to recommend for people that want it, and this is true both at the Domar Center and at Dana Farber, I tend to recommend whey protein powder. Simply because it mixes into things pretty well. You can get flavored or you can get unflavored. And it's very high in an amino acid called leucine, which is really good for maintaining your muscles. And Consumer Reports a few years ago did an analysis with an organization called the Clean Label Project. And what they did is they put a bunch of protein powders through a battery of tests to look for heavy metals, things like arsenic and mercury, quality purity and all that kind of stuff. And they actually found that whey and egg protein powder were the cleanest. Now, not all the plant protein powder people obviously agree with their findings, though I generally find that Consumer Reports is pretty credible. The theory was that animals with a ruminant GI tract, like cows and chickens, the ruminant GI tract may remove a lot of the heavy metals, and heavy metals are toxins that you want to try to limit when you're trying to conceive and when you're pregnant. So I know I'll probably get hate mail from people that make plant protein powders, but that's just my personal recommendation. Is there anything I can do to naturally increase egg quality? So I already touched on this, and this is going to be recorded so people can go back and look at it. I'll circle back to that if I have any time. I just want to look at additional questions, but I did address that in a lot of detail. Same thing with the acne from PCOS. So it is trying to manage underlying insulin resistance. And there's one other thing I can say about acne. So there's research on acne and diet, and this is not specific just to PCOS, that suggests that some people with cystic acne, their acne may get worse with dairy, primarily milk, I believe. So, but that's certainly not everybody. So the information I've read says it's like kind of preliminary research, but this can make people miserable, and you may be, kind of happy to just set aside the dairy for 6 weeks or something and see if you feel like it affects your acne, makes it better. If it doesn't, there's no reason to avoid dairy products. So in general, I recommend, 1% milk and yogurt. However, there is research from the Harvard School of Public Health, Jorge Chavarro and company, that as part of the Nurses Health Study found that consuming as little as 1 serving of full fat dairy daily seemed to correlate with fewer complaints about fertility. So we don't really know what that is. Is it that there's fat soluble hormones in dairy that benefit fertility, that when you take the fat out and make it 1% or non-fat, you're not getting that those whatever hormones, if that's what's causing it? I'm certainly have no problem with people having a serving, like a glass of whole milk or a full fat yogurt once a day. In general, animal fat is considered something that would worsen insulin resistance. So it's very likely that the saturated fats in cheese, for example, are different from the saturated fats in red meat. Red meat should be consumed in moderation for a lot of health reasons. including, as I already mentioned earlier, endometriosis, saturated fat, which is animal fat, tropical oils. We think worsen insulin sensitivity, and vegetable oils like olive oil, canola oil, peanut oil, avocado oil may assist with insulin resistance, improve insulin sensitivity. When people say don't eat a lot of red meat, often there's not a full-on recommendation on exactly what do you mean by that. I can tell you that the American Institute for Cancer Research recommends people limit red meat, largely because of a connection between GI cancers, most prominently colorectal cancer. And so they say limit red meat and avoid processed meats. Processed meats are like the pink things: bologna, salami, bacon, ham, sausages. Those kinds of things should be enjoyed on occasion, but I would definitely discourage people consuming those daily in the form of like sausage patties and you know, Canadian bacon in your egg sandwiches. Again, I don't care what people do sometimes. I'm interested in most of the time, so I kind of call myself the 80-20 person. But there seems to be a lot of health reasons to try to limit processed meats to occasional consumption. Red meat in general is beef, pork, lamb, and veal. The American Institute for Cancer Research recommends no more than 12 to 18 ounces a week. So if you think that 3 ounces of meat, beef, pork, lamb, veal, once it's cooked, is about the size of a deck of cards, they're suggesting no more than 4 decks of cards of red meat weekly. And I think that that makes a lot of sense for heart health, and, you know, insulin resistance and all the rest. Hi, Diana. As far as collaborative care teams, do you work with a reproductive endocrinologist or OBGYN? So I am part of Boston IVF. So they're reproductive endocrinologists. The PCOS Diet Plan could have, absolutely. The PCOS Diet Plan, the only difference between this book and this book is this comes at insulin resistance from the standpoint of as it plays out in PCOS, because the most common manifestation of insulin resistance in general is diabetes. The Prediabetes Diet Plan just talks about how to manage insulin resistance in general. And there's nothing over restrictive about it. Again, I just am never going to believe that there's some over restrictive diet out there with some new theme that people follow for a period of time until they get sick of it, and then somehow transition out of it without regaining a lot of the weight that they lost on it. So I can tell you that rapid weight loss prior to IVF may be counterproductive, and there's some research studies to back that up. So kind of crash dieting prior to IVF is something that I discourage. If you're a skinny beach like me, 2% milk yogurt is a great way to sneak in the fat. Yeah, absolutely. Which keeps the periods coming. Yeah, so, you know, the full fat dairy thing, again, individual foods do not affect your health unless you have a bad allergy. It's what are you eating most of the time versus what are you eating some of the time. I was reading to the Dietary Guidelines for Americans 2020 recently, and they said in there, somewhere that I found, that if 85% of the calories you're eating are coming from foods that are giving you other nutritional benefits, it doesn't really matter where the other 15% are coming from. So again, 85% is huge and 15% is small. Those are your, what I call calories for fun, discretionary calories. I will tell you, and I say this all the time to my patients when I meet with them, I am much more interested in what you are eating than what you're avoiding. Because just because somebody doesn't go to McDonald's or drink soda doesn't mean they eat at least 2 servings of fruit a day, at least 3 servings of vegetables. Try to buy grains that are whole grains. Try to eat more poultry and seafood than red meat. You know, those are all choices of foods that you put into your body. Nuts and seeds and beans, tons of health benefits, loaded with fiber. Good nutrition is much more about giving yourself an opportunity to consume those foods. That's an action you have to partake in. That's different than just not eating something. Is metformin safe in the second trimester? Again, outside my lane. I would defer to the reproductive endocrinologists on that one. Okay, we have a few minutes left. I don't see any other questions, Emily, unless you have any in your bag of tricks that you want to throw up there. Trying to think what would be something that I think is important to share. What I would, oh, thanks, Dana. What I would say is, of the stuff that you read online, Dr. Google and company, what upsets me the most about it is it becomes another source of stress in people's lives to go online and read all this stuff that feels like it gives you whiplash because you said, you know, oh, I thought that wasn't true. I've been trying to do this, and then I read this other thing. It's really important to know that one study does not change a whole body of evidence. So when we're talking about evidence-based health information, we're talking about information that has been started out small, the research started out small, and more research built on top of that, that sends a pretty consistent message about the health benefits or detriments of something. Individual studies don't make all the body of evidence collapse. And when you read stuff online that says, according to one study, and you'll notice that 90% of the time, they don't even give you the study. So you can't read it. And if you did read it, you might find that is it like in a petri dish, in a lab? Is it in mice? Is it in rats? Is it in pigs? Is it in people? How many people is it on? What kind of research study was it done? What was controlled for additional outcomes? You know, I say, shut up the chatter. I'm telling you, I see this every single day at Dana Farber as well. I mean, how stressful for somebody trying to deal with a cancer diagnosis, and now everybody around them is online looking for stuff and throwing information at people. And from that standpoint, the fertility world and the cancer world are very similar. You have emotionally very vulnerable people who are being assaulted with information that you don't even know if it's true or not. So do understand, we know a lot about good nutrition. When people say, oh, they used to say this and now they say that, well, that's because the research, nutrition's a super young science. So things are going to evolve and change, but they don't change at the speed of light. And so be very mindful of the sources of information that you go searching for just mostly to be kind to yourself. I mean, I feel like what I end up doing with a lot of my patients is letting them off the hook, that they don't have to believe everything they read online. Diana, you're super cute. She helped me a lot and changed the way I see my eating habits and PCOS and IVF. Thank you, hon. All right, I don't see any more questions unless anybody, oh, cool, thanks. She's a cool, young, everything in moderation. Be kind to yourself. Yes, it's true. It's true. Stress is definitely not good for you. So food should be something that you can add to your repertoire to help you feel like you're doing something to help yourself when you're otherwise feeling like it's being stripped away from you. Again, I've been there, I get it. Fertility treatment is all about timing. Be here on this day, have this blood test, have this exam, do this test, have this biopsy, take this shot. It's very regimented and stressful and feels like it's all out there. Healthy eating and exercise. Exercise is nothing but good for fertility, as long as it's not creating so much competition for calories that it could be telling your hypothalamic reproductive hypothalamic pituitary ovarian axis, if there's too much exercise going and not enough food coming in, the body or the brain could say, you know what, there's too much competition for calories. This would not be a good time to conceive, and can shut down reproductive function. So that's what hypothalamic amenorrhea is. It's not getting your period because your hypothalamus, which is the survival manager in the brain that's constantly trying to figure out what's going on in the world. Do I need to adjust in a way to survive this world? And it might decide this is not a good time to be pregnant. But that is too little food, way too much activity, often requires cutting the activity way back and bumping the calories up to like 2,500 calories a day for months. So that's an extraordinary circumstance. But in general, walking, physical activity is the most natural way to beat off the fight or flight response. It is nothing but good for fertility as long as it's not extreme. Caveat being, if you're on a stim cycle, you don't want to be jumping around. Okay, if I was to lose 10% of my body weight, will that help regulate my period? It very well could. It very well could. Thoughts on celery juice for fertility? Again, I don't believe that individual foods make anything turn on or off. Do I worry about celery juice? It's interesting. I was just having this conversation with one of my sons. You know, now processed meat companies are now starting to sell uncured bacon, uncured ham. And I actually called the American Institute for Cancer Research, which is the organization that recommends limiting processed meat. And they said what they often do in place of the nitrates and the nitrites, which they don't 100% know what might be raising people's risk for colon cancer. Something going on out there. I don't know if many people have heard they're now recommending colonoscopy starting at age 45 instead of waiting to 50 because younger people are getting colon cancer. The nitrates and the nitrites are probably part of it. What I was told by them is that celery juice becomes the replacement natural preservative for the nitrites, and that we don't know if that's different. We would assume it's different, and it puts celery juice in a different perspective in my head. So given that I don't believe that individual foods, you know, fix fertility problems or crash fertility, I would say consumed in a you know, as part of a balanced diet is fine, but I don't think it has any magical powers. All right, it's 8 o'clock. Emily, I think we're good. Thanks for tuning in. It's nice to see you all. Thank you.